I have to thank, of course, those involved in this, and I'm certainly very grateful to the Helen Keller Foundation and the prize committee. I'm really proud to be added to your list of awardees. And maybe you would like to know, first time I heard about Helen Keller. That is some 60 years ago. I went to school in a small place in Sweden, and the teachers there, several of them, told the story about Helen Keller. And we were all very impressed about this. And of course the teachers also pointed out the role of Annie Sullivan. And we realized that she was doing a great job. And we heard this story many times, in fact. And I think there is a very simple reason. There is no better story about the importance of education and learning and teaching. And I think it will remain that way for hundreds of years. So Helen Keller's name will most probably be remembered long after we all have been forgotten. Well, it's very nice to get a prize, but it's a rare thing. So it's very fortunate that there are so many other nice things in science. I'm thinking of getting a thrilling idea. When you read a paper, you feel there's something fishy here. I'm thinking of preliminary experiments that work the way you expected, or maybe even better, turned out quite unexpected. And I'm also thinking of the mail when you open it and suddenly see you've received a considerable grant. And also, of course, the pleasure it is to meet other people and discuss with them, and to disagree, and to be angry, and to enjoy life when it is really nice. So after this, I would like to present some personal moments of happiness of this kind to you. And I would also like to mention some names. And the first name is that of Olof Rudbeck. He was a very famous professor in Uppsala some 300 years ago. And as an old professor, he indulged in speculations about Sweden as being the lost continent of Atlantis. And of course, as so often with old professors, that was all rubbish. But as a young man, he had made a really significant discovery. He was the man who discovered the lymph vessels. And we know now that the lymph vessels are very important. A small amount of plasma protein leaves the tissue, the blood vessels in every tissue, and there is no way for it to return into the blood vessels locally. So it has to be drained away with the tissue fluid via the lymph vessels, and it will be much delayed during its passage through the lymph vessels. It's a slow system. Well, so that was rather common knowledge in Uppsala, I can tell you, and I was really surprised then to read in Adler's Physiology of the Eye, very good book, that there were no lymph vessels in the eye. And the author suggested that maybe that was because perhaps there was no need for lymph vessels, because possibly there was no protein leakage in the eye. And I read it once again and thought that this sounds like Atlantis. This has the ring of it ain't necessarily so. So I developed a method to determine protein permeability in any tissue, in fact. And one of the first experiments demonstrated very clearly that there was a good deal of plasma protein leakage in the choroid and also in the ciliary body. So obviously, I now had to try and find what happened to the fluid. And I had some rather good ideas, but to clear my thoughts, I injected a small amount of plasma albumin labeled with Evans blue just under the sclera. And then I just sat and waited, because I knew if it was lymph vessels, it would take time. So I just sat and waited. And I can tell you, I was amazed to see a small blue spot on the outside of the sclera, and it grew in size. And then the blue material started to enter the lymph vessels outside the eye. So in that single experiment, I had the explanation. The tissue fluid moved out through the scleral substance and was picked up into the lymph vessels on the outside of the eye. I was rather pleased, I can tell you. Well, then it's time to mention another name, and that is Ernst Barany. Many of you here knew him, and I think we could all agree that he was a brilliant man, if there was one, and also that he was a delightful person. And he taught me two really important things. One was how to use monkeys in eye research, and the other was how to write a good application to NIH. And some months passed, and maybe a year, and then I had the white envelope from NIH. They were giving me what I have asked for, and that is very un-European. And they were giving it for 3 years. So suddenly I had the feeling I had seen a glimpse of heaven. I could do whatever I wanted for 3 years. No economical problems at all. I was pleased indeed. Well, I was soon using my labeled plasma proteins to try and determine aqueous flow. I injected them into the anterior chamber and expected that I could calculate aqueous flow in two ways. One was to see how quickly it passed out from the anterior chamber, and the other was to see how quickly it appeared in blood. And I run into an accounting problem. In some monkeys, the outflow from the anterior chamber was more than twice the flow to blood. So there had to be some other pathway, unknown as far as I know, for aqueous humor drainage in the primate eye. And you can understand I was excited. I made some autoradiographs after such experiments and could see immediately that there was a movement had been a movement of aqueous humor into the ciliary muscle, into the supraciliary space, into the suprachoroidal space, out diffusely through the sclera and into the episcleral tissues. That was a rather wonderful thing, really. And I spent a lot of time on the physiology and pharmacology of these roads. And then I wanted to see if, I mean, that was all in monkeys. What about humans? And I was fortunate enough to be helped by Calvert Phillips, who was in Manchester at that time. He had very friendly relations with all his patients. He was a very, very delightful person too. And they had no objections if he suggested that maybe we could do some experiment before the enucleation of a tumor eye. And so we could do a few such experiments. I think that would never be allowed nowadays. Anyway, I was pleased to see that there was this uveoscleral flow in the human eye as it was in monkeys, but in the eyes that we could get, it was much lower than in monkeys. So I felt glad it was there and sad it was so little. But then I realized that maybe one day there will be a drug that can open up these routes. And if that was the case, it might be a drug that could be very useful in glaucoma. And I had to wait, and I had to wait, and I waited for 20 years. And then, of course, Laszlo Bito and Johan Stjernschanz developed the prostaglandins that open up these roads and that lower the pressure in normal eyes, and wonderfully enough also in glaucoma eyes. So I have had the feeling for some time that my rather ugly duckling has developed into a swan that flies around. And to be even more personal than that, I can tell you that my father was always complaining about his pilocarpine drops. And my dear wife Inga is very pleased with her prostaglandin drops. And let me end by a quote from Helen Keller. "Help me to hasten the day when there shall be no blindness." Well, I think we may have taken a few steps, but the way is long, and there is much to be done by scientists, but certainly also by funding organizations. Thank you all very much.